Foodborne Giardiasis is a type of infection that affects your digestive system. Let's break down exactly what this means and how it happens. Giardiasis is an infection that specifically targets your small intestine. This is the part of your digestive system where most of your food gets absorbed into your body. The infection is caused by a tiny parasite called Giardia duodenalis. This microscopic organism is so small you can't see it without a microscope, but it can cause significant problems in your digestive system. Now let's look at how you actually get this infection. You get foodborne giardiasis by eating contaminated food or drinking contaminated water. The parasite gets into your system when you consume something that contains these microscopic organisms. This makes giardiasis what we call a diarrheal disease. To summarize, foodborne giardiasis is an infection of your small intestine caused by the Giardia parasite. You get it from contaminated food or water, and it's classified as a diarrheal disease because it primarily affects your digestive system. The Giardia parasite has a fascinating life cycle with two completely different forms. Understanding these two forms helps us understand how the infection spreads and causes disease. First, we have the cyst form. Think of cysts like protective seeds. They have a tough outer shell that protects the parasite when it's outside the human body. Cysts are incredibly hardy. They can survive for weeks or even months in water, soil, or on surfaces. This protective shell makes them the perfect form for spreading from person to person. The second form is the trophozoite. This is the active living form that actually causes the infection. Trophozoites look completely different from cysts. Trophozoites have whip-like structures called flagella that help them move around. They attach to the wall of your small intestine, where they feed and multiply, causing the symptoms of giardiasis. Here's the key difference. Cysts are the survival form that spreads the infection, while trophozoites are the disease form that actually makes you sick. Both forms are essential to the parasite's life cycle. Understanding these two forms helps explain how Giardia infections work. The hardy cysts survive outside the body and spread the infection, while the active trophozoites cause the illness once inside your intestines. Giardia spreads through what scientists call the fecal-oral route. This might sound complicated, but it's actually a straightforward concept that explains how this parasite moves from one host to another. The fecal-oral route means that Giardia cysts from the feces of an infected person or animal somehow end up being ingested by a healthy person. This creates a cycle of transmission. When an infected person or animal has a bowel movement, millions of microscopic Giardia cysts are shed in their feces. These cysts are incredibly hardy and can survive outside the body for weeks or even months. Poor hygiene is the main factor in transmission. When someone doesn't wash their hands properly after using the bathroom, microscopic cysts can remain on their hands, under their fingernails, and on surfaces they touch. There are several ways these cysts can reach someone's mouth. Contaminated hands can spread cysts during food preparation or when touching surfaces that others will later touch. Direct contact between people, especially in childcare settings, is also common. The final step occurs when these microscopic cysts somehow enter a person's mouth. This can happen when eating contaminated food, drinking contaminated water, or simply touching your mouth with contaminated hands. The key insight is that this transmission requires poor hygiene and sanitation. As few as 10 cysts can cause infection, but proper hand washing and sanitation can break this cycle completely. The infection process begins the moment you ingest Giardia cysts. Understanding this critical first step helps us see how easily this parasite can establish itself in your body. Here, we see Giardia cysts approaching the mouth. These microscopic parasites are about to begin their journey into your digestive system. What makes Giardia cysts so dangerous is their incredible durability. These parasites have a thick protective outer shell that allows them to survive outside the human body for weeks or even months. When you consume contaminated food or water, these hardy cysts enter your mouth and travel down your digestive tract. They can easily survive the journey through your stomach acid. Here's the most surprising fact about Giardia infection. You don't need many cysts to get sick. As few as 10 cysts can establish a full infection in your intestines. Once these cysts reach your small intestine, they begin their transformation. The protective shell starts to break down, preparing to release the active form of the parasite called trophozoites. The key takeaway is that Giardia cysts are remarkably resilient parasites that require very few numbers to establish infection. Once ingested, they begin their transformation in your small intestine, setting the stage for the next phase of infection. Now we reach a critical stage in Giardiasis. The trophozoites have multiplied in your small intestine, and they're about to cause the main problems associated with this infection. To understand how trophozoites cause symptoms, we need to look at your small intestine. The intestinal wall is lined with tiny finger-like projections called villi. These villi are absolutely essential for absorbing nutrients from your food. Under normal conditions, nutrients from digested food flow past these villi and get absorbed into your bloodstream. This is how your body gets the vitamins, minerals, and energy it needs to function properly. But when Giardia trophozoites are present, they attach directly to these villi. The parasites use specialized structures to stick firmly to the intestinal wall, right where absorption is supposed to happen. This attachment creates a major problem. The trophozoites physically block the villi from doing their job. They interfere with the normal absorption process, preventing nutrients from entering your bloodstream effectively. Additionally, the presence of these parasites damages the villi themselves. They can cause inflammation and reduce the surface area available for absorption. This creates a double problem: physical blocking plus tissue damage. The result is malabsorption. Your body cannot properly absorb the nutrients it needs. This leads directly to the symptoms of Giardiasis: diarrhea, weight loss, fatigue, and nutritional deficiencies. This interference with absorption is the core mechanism behind Giardiasis symptoms. The more trophozoites present, the more severe the malabsorption becomes, leading to increasingly uncomfortable and potentially dangerous symptoms. As trophozoites move through your digestive system, they undergo a crucial transformation. When they sense changes in their environment, they begin converting back into their protective cyst form. The transformation is triggered by environmental changes as the parasites move from the small intestine toward the large intestine. The changing pH levels and different conditions signal the trophozoites to form protective walls around themselves. During this transformation, the trophozoites lose their flagella and develop a thick, protective outer wall. This cyst wall is incredibly durable and allows the parasite to survive harsh conditions outside the human body. These newly formed cysts then move through the large intestine and are eventually excreted in feces. Unlike the fragile trophozoites, these cysts can survive for weeks or even months outside the body. This completes the parasite's life cycle. The excreted cysts are now ready to infect new hosts if they contaminate food or water sources. This is why proper sanitation and hygiene are so important in preventing the spread of Giardiasis. Food contamination with Giardia cysts happens in several ways, but the most common route is through infected food handlers who don't practice proper hand hygiene. When food handlers are infected with Giardia, microscopic cysts can be present on their hands, even though they're completely invisible to the naked eye. These contaminated hands can then transfer Giardia cysts directly to food items during preparation, serving, or handling. Fresh fruits, vegetables, and ready-to-eat foods are particularly vulnerable because they often receive minimal or no cooking that would kill the parasites. The key takeaway is that proper hand washing by food handlers is critical to preventing contamination, as even a small number of cysts can cause infection. Another major way food gets contaminated with Giardia is through contaminated water used in food production and preparation. When contaminated water is used for irrigation, Giardia cysts can be sprayed directly onto crops. This is especially problematic for produce that's eaten raw, like leafy greens and berries. Even at home, washing fruits and vegetables with contaminated water can transfer Giardia cysts onto the food surface. This is why using clean, treated water for washing produce is so important. The key takeaway is that water quality matters at every step of food production and preparation. Always wash your produce thoroughly with clean, treated water to reduce the risk of Giardia contamination. Animals play a significant role in Giardia contamination of food sources. Many different types of animals can carry and shed Giardia cysts in their feces. These animals shed Giardia cysts in their feces, which can then contaminate the environment around them. Farm animals like cattle and pigs, pets like dogs and cats, and even wildlife such as birds can all be carriers. Now let's examine the specific ways animals contaminate food sources. The first pathway is direct contact contamination. When animals walk through crop fields or graze near produce, they can directly contaminate fruits and vegetables with fecal matter containing Giardia cysts. Another important contamination route involves water sources used for irrigation. When animals defecate near water sources like streams, ponds, or wells, they contaminate the water with Giardia cysts. This contaminated water is then used to irrigate crops, spreading the contamination to produce. Certain types of foods are at particularly high risk for animal contamination. Foods that are eaten raw or with minimal processing are at the highest risk for animal contamination. This includes leafy greens, berries, root vegetables, and raw dairy products like unpasteurized milk and soft cheeses. The key takeaway is that animal contamination is a significant pathway for Giardia transmission, especially for foods consumed raw. Understanding this helps us make better food safety decisions. When it comes to Giardia contamination, not all foods carry the same level of risk. Understanding which foods are more dangerous can help you make safer choices. Foods in the high-risk category are those eaten raw or with minimal processing. Fresh salads are particularly risky because leafy greens can harbor Giardia cysts and are typically eaten without any cooking process to kill the parasites. Fresh fruits also fall into this high-risk category. While we might wash them, this minimal processing isn't enough to eliminate all Giardia cysts that might be present on the surface. Undercooked meats represent another major risk. When meat isn't cooked to proper temperatures, any Giardia cysts present can survive and cause infection when consumed. Medium-risk foods include those that have undergone some processing but aren't fully cooked. These might include certain dairy products or lightly processed foods that haven't been subjected to high heat. Low-risk foods are those that have been fully cooked or properly processed. High heat effectively kills Giardia cysts, making these foods much safer to consume. Pasteurized items like milk and juice are also low risk because the pasteurization process uses heat treatment specifically designed to kill harmful pathogens, including Giardia. The key takeaway is simple. Heat and proper processing are your best defenses against Giardia. When possible, choose cooked foods over raw ones, especially when traveling or in areas with questionable sanitation. When someone gets infected with Giardia, they typically experience several uncomfortable symptoms. These symptoms primarily affect the digestive system and can significantly impact daily life. The most common symptom is diarrhea. This isn't just any diarrhea. It's often watery, frequent, and has a particularly foul smell that patients find very unpleasant. Abdominal cramps are another major symptom. These are painful muscle contractions in the stomach area that can range from mild discomfort to severe pain. Bloating is also very common. Patients feel like their stomach is swollen and full of gas, making them uncomfortable and affecting their appetite. Nausea and vomiting often occur together. Patients feel sick to their stomach and may actually throw up, which can lead to dehydration if severe. Weight loss can happen because people lose their appetite and may not be absorbing nutrients properly. This is especially concerning in children and elderly patients. Here's something important to remember. Not everyone who gets infected will show symptoms. Some people are what we call asymptomatic carriers. They have the parasite but feel perfectly fine. This makes Giardia particularly tricky because asymptomatic people can still spread the infection to others without even knowing they're infected. Both types of people can pass the parasite through poor hygiene practices. Understanding when Giardiasis symptoms appear and how long they last is crucial for recognizing this infection. The timing can be quite different from other foodborne illnesses. When you're first exposed to Giardia parasites through contaminated food or water, you won't feel sick right away. Your body appears completely healthy at this point. Here's what makes Giardiasis tricky. There's a significant delay before symptoms appear. Unlike some foodborne illnesses that make you sick within hours, Giardiasis symptoms typically don't start until 1 to 3 weeks after your initial exposure. This delayed onset means you might not connect your illness to the contaminated food you ate weeks earlier. You could feel perfectly fine for 2 or even 3 weeks before the first symptoms appear. Once symptoms do start, they don't just last a few days like a typical stomach bug. Giardiasis symptoms can persist for several weeks, making you feel pretty miserable for an extended period. This extended timeline, weeks before symptoms start, then weeks of feeling unwell, is one of the most challenging aspects of giardiasis. It's important to be patient and seek medical attention if symptoms persist. Beyond the main digestive symptoms we discussed, giardiasis can cause several other important symptoms that affect your overall well-being. Adults with giardiasis often experience persistent fatigue and a significant loss of appetite. The fatigue can be quite debilitating, making daily activities feel exhausting. Children with giardiasis may present differently than adults. Their symptoms can be more subtle, but equally important to recognize. In children, giardiasis often presents as abdominal pain with minimal diarrhea. This can make it harder to diagnose since the classic watery diarrhea may not be prominent. These additional symptoms are important because they can significantly impact quality of life and may be the primary complaints that bring patients to seek medical care. When doctors suspect you might have giardiasis, they need to confirm the diagnosis through laboratory testing. The primary method used is stool testing. Stool tests are the gold standard for diagnosing giardiasis. These tests specifically look for 2 forms of the Giardia parasite in your stool sample. The laboratory technicians examine your stool sample under a microscope, searching for 2 specific forms of the Giardia parasite: cysts and trophozoites. Sometimes, a single stool test might not detect the parasites, even if you're infected. This is why doctors often request multiple stool samples collected on different days. The reason for multiple samples is that Giardia parasites are not always shed consistently in stool. Testing samples from different days increases the chances of detecting the infection if it's present. Key takeaway: stool testing is the reliable way to diagnose giardiasis. If your first test is negative but symptoms persist, don't be surprised if your doctor requests additional samples to ensure accurate diagnosis. When giardiasis is diagnosed, there are 3 main medication options available to eliminate the parasites from your intestinal tract. The first 2 medications, tinidazole and metronidazole, are the most commonly prescribed treatments. Both are highly effective at eliminating Giardia trophozoites from the small intestine. Albendazole is the third treatment option. Research shows that albendazole may be just as effective as metronidazole, but with an important advantage: it typically causes fewer side effects for patients. All 3 medications work by targeting the Giardia parasites directly, disrupting their ability to survive and reproduce in your intestinal tract. Your doctor will choose the best option based on your specific situation and medical history. The choice between these medications depends on factors like potential side effects, your medical history, and any other medications you might be taking. The key takeaway is that effective treatment options are available to clear Giardia infections. Not everyone infected with Giardia needs treatment. The decision depends on whether you have symptoms or not. Both people shown here are infected with Giardia parasites. However, the person on the left has no symptoms at all. They're what we call an asymptomatic carrier. The general rule is simple: if you have Giardia but no symptoms, you usually don't need treatment. Your immune system can often handle the infection on its own. In contrast, people with symptoms like diarrhea, cramps, or nausea typically do need treatment to help their body fight the infection and recover faster. However, there's an important exception to this rule. Even if you have no symptoms, your doctor might still recommend treatment to prevent you from spreading the parasite to others. This is especially important if you work in food service, childcare, or healthcare, where you could easily pass the infection to vulnerable people. Public health is the key consideration here. Remember, even without symptoms, you can still shed Giardia cysts and infect others. The decision to treat asymptomatic cases is always made by weighing individual health against community protection. When Giardia infection causes malabsorption, treatment becomes essential for your recovery. Let's understand why this happens and how treatment helps. In a healthy intestine, tiny finger-like projections called villi help absorb nutrients from food. These villi have a large surface area that efficiently captures vitamins, minerals, fats, and proteins. However, when Giardia trophozoites attach to your intestinal wall, they damage these villi. The villi become flattened and inflamed, dramatically reducing the surface area available for nutrient absorption. This malabsorption leads to serious problems. Your body cannot get the nutrients it needs, even if you're eating well. You may experience weight loss, vitamin deficiencies, and fatigue as your body struggles to function properly. This is why treatment is strongly recommended when malabsorption occurs. Medications like metronidazole or tinidazole eliminate the Giardia parasites, allowing your intestinal wall to heal and restore normal absorption. After successful treatment, your villi can regenerate and return to their normal function. This restoration allows your body to properly absorb nutrients again, helping you regain strength and recover from the infection. Remember, if you're experiencing symptoms like persistent diarrhea, weight loss, or fatigue that suggest malabsorption, it's important to seek medical treatment promptly to prevent long-term nutritional complications. Proper hand washing is one of the most effective ways to prevent Giardiasis infection. When done correctly, it removes Giardia cysts from your hands before they can enter your body. You should wash your hands at critical times, especially after using the bathroom and before preparing or eating food. These are the moments when Giardia cysts are most likely to transfer from your hands to your mouth. Proper hand washing technique involves 5 simple steps. First, wet your hands with clean running water. Then apply soap and lather well, making sure to scrub all surfaces, including between fingers and under nails. Continue scrubbing for at least 20 seconds, about the time it takes to sing Happy Birthday twice. Finally, rinse thoroughly with clean water and dry with a clean towel or air dry. Remember, effective hand washing physically removes Giardia cysts from your hands, breaking the chain of transmission. This simple practice can protect you and others from infection. Safe food handling is your first line of defense against Giardia contamination. 3 key practices will protect you and your family: cooking foods thoroughly, washing produce carefully, and preventing cross-contamination in your kitchen. Heat kills Giardia cysts effectively. Use a food thermometer to ensure proper internal temperatures. Poultry should reach 165 degrees Fahrenheit, ground meats 160 degrees, and whole cuts of beef and pork 145 degrees. Always wash fruits and vegetables under running water, even if you plan to peel them. Scrub firm produce with a clean brush, remove outer leaves from leafy vegetables, and dry with a clean towel. This removes surface contamination that could harbor Giardia cysts. Cross-contamination occurs when harmful microorganisms transfer from one surface to another. Use separate cutting boards for raw meat and vegetables. Wash your hands between handling different foods. Clean surfaces immediately after use, and store raw meat on the bottom shelf of your refrigerator to prevent drips. Remember, safe food handling creates multiple barriers against Giardia contamination. Proper cooking kills parasites, thorough washing removes surface cysts, and preventing cross-contamination stops the spread. These simple practices in your kitchen are powerful tools for protecting your health. Untreated water from natural sources is one of the most common ways people get infected with Giardia. Understanding which water sources to avoid is crucial for preventing this parasitic infection. Lakes, rivers, and wells can all contain Giardia cysts, even if the water looks clean and clear. These microscopic parasites are invisible to the naked eye, but can survive in water for months. These water sources are particularly dangerous because they can be contaminated by infected animals or human waste upstream. Even pristine-looking mountain streams can harbor Giardia cysts. If you find yourself in an emergency situation where you must drink untreated water, boiling is your best defense against Giardia and other waterborne parasites. Bring the water to a rolling boil at 212 degrees Fahrenheit or 100 degrees Celsius. Maintain this boiling temperature for at least 1 full minute to kill Giardia cysts and other harmful microorganisms. The best approach is to always choose safe water alternatives when possible. Bottled water, properly treated municipal water, and water purification tablets are much safer options. Remember these key points. Avoid drinking from natural water sources. Boil untreated water for at least 1 minute if you have no other choice, and always opt for bottled or properly treated water when available. Proper sanitation is one of the most important barriers against giardiasis. When sewage systems fail or are inadequate, Giardia cysts can contaminate water supplies and food sources, creating widespread health risks. Sewage treatment plants are designed to remove harmful pathogens like Giardia cysts from wastewater. Raw sewage containing Giardia enters the treatment facility, goes through multiple purification stages, and emerges as safe, clean water. When sanitation systems fail, the consequences can be severe. Broken sewage pipes, inadequate treatment, or poor waste disposal allow Giardia cysts to escape into the environment, contaminating water sources and creating health hazards for entire communities. Effective sanitation requires multiple components working together. This includes maintaining sewage treatment systems, ensuring proper waste disposal, and conducting regular inspections to identify and fix problems before they lead to contamination. Remember, proper sanitation is a community-wide effort that protects everyone from giardiasis. When sewage systems work correctly and waste is properly managed, we create a barrier that prevents Giardia cysts from reaching our water and food supplies. Understanding your risk factors for giardiasis helps you make informed decisions about prevention. Several key factors can increase your likelihood of infection. Poor sanitation and hygiene practices are major risk factors. This includes inadequate hand washing, especially after using the bathroom or before handling food. Drinking untreated water is another significant risk factor. This includes well water, stream water, or any water source that hasn't been properly filtered or boiled. Traveling to areas where giardiasis is common significantly increases your risk. This is especially true in developing countries with poor water treatment infrastructure. Close contact with infected individuals poses a risk, particularly in settings like daycare centers, households with infected family members, or healthcare facilities. Additional risk factors include wilderness activities like camping or hiking, certain occupations that involve contact with human waste, and specific populations such as daycare workers. Being aware of these risk factors allows you to take appropriate precautions. The more risk factors that apply to you, the more important it becomes to follow prevention strategies like proper hygiene and safe food handling.